Brian Lehrer on WNYC. On our Tuesday shows, we like to bring the science on a topic in public health, often climate-related, often other health-related science. As it happens, we will talk a lot about environmental health tomorrow, because tomorrow is Earth Day, as we just mentioned in that break. Here's what we'll do today. Did you catch the announcement by President Trump over the weekend that he's going to make it easier to research the potential health benefits of certain psychedelic drugs? These include LSD, MDMA, also known as ecstasy or Molly, psilocybin, and ibogaine. Veterans groups have been especially interested in this after some reported success treating war-induced PTSD. At the announcement, Trump was flanked by several of his health-related appointees, RFK Jr. and others, but the origin story of this announcement came from perhaps a surprising source who was there, the podcaster Joe Rogan. Here's 40 seconds of what he said.
I sent President Trump some information. We have a gigantic opiate problem in this country, obviously. In 2024, more than 80,000 people died of overdoses. It's a horrible number. And there's more than 5 million people that are addicted to opiates right now in this country. With one dose of ibogaine, more than 80% of people are free of that addiction. With 2 doses, it's more than 90%. I sent him that information. The text message came back, sounds great. Do you want FDA approval? Let's do it. And it was literally that quick.
Yeah, it was that quick. Podcaster with connections calls the president. The president says, hey, cool, man, let's do it. And poof. But to be fair, the executive order does not legalize any of those drugs for treatment. It makes it easier to research them. That includes risks as well as benefits. And frankly, from what I'm seeing, almost nobody opposes that. And to be clear, this is not about legalizing for recreational use. Don't look for ecstasy dispensaries anytime soon. So let's see what we know and what we don't know about the mental health potential of certain psychedelics to treat addiction, as Joe Rogan was emphasizing, post-traumatic stress, and more. With me for this is Frederick Barrett, Ph.D., Director of the Center for Psychedelic and Consciousness Research at Johns Hopkins University. Dr. Barrett, thanks for coming on. Welcome to WNYC.
Oh, thank you so much for having me, and thank you for highlighting this, what I think is an important area, of course.
Yeah, well, perhaps the substance getting the most press since the president's announcement is ibogaine. That's what we heard Joe Rogan reference in the clip. So for the uninitiated, can you explain what ibogaine is and why Joe Rogan or veterans groups or others think it's already been helping some people?
I'd be happy to do so. So ibogaine is a psychoactive compound that is naturally occurring, and it can be found in the iboga plant, which is native to West Africa and traditionally used in West African spiritual practices. It is a very unique compound in a few different ways. One of the ways that it's unique is that unlike other classic psychedelic drugs that you listed, such as psilocybin or LSD, that only interact with a small number of brain systems directly, ibogaine seems to interact quite widely with a much larger number of brain systems, including the serotonin system, the dopamine system, and the opioid system. Serotonin is involved widely in a number of processes, such as sleep and mood. It's implicated in depression. The dopamine system is involved in substance use disorder, but also just normal everyday learning and responding to rewards and punishments. The opioid system, of course, is responsive to pain relievers in some cases. It's involved in the regulation of pain, and it's but ibogaine seems to interact with even a much larger number of brain systems than just those. It's thought that because of its kind of much more intense interaction with the brain, and specifically with the opioid system, that ibogaine may have unique properties above and beyond other classic psychedelics. One of the claims that's made about ibogaine is that after only a single dose, people, especially who are suffering from opioid use disorder, and of course, this is in the context of the opioid epidemic, which is still ongoing in this country. ibogaine may reset craving and withdrawal for opioids, which, dealing with craving and withdrawal is a huge challenge in patients with opioid use disorder. If these claims are true, it would represent a remarkable advance in our ability to treat these illnesses.
You say if these claims are true, you heard the Joe Rogan clip. He said 90% of people who take 2 doses of ibogaine kick their opioid addictions. Is that real science, or is that podcaster chatter?
I'd say somewhere in between, frankly. There have been surveys and reviews of people who have gone overseas to receive this treatment, but none of this to date has been done within a controlled experimental context, and I'll tell you why. Because ibogaine is one of the very few psychedelic compounds that actually has a really known and substantial cardiovascular risk. So it's this cardiotoxicity that sadly has led to some deaths in overseas retreats, and it makes it a much higher bar for screening and assessment and monitoring during treatment, and also because of this, it's been almost impossible to get permission to study these drugs in the U.S. because of this known cardiotoxicity.
As we continue with Frederick Barrett, Director of the Center for Psychedelic and Consciousness Research at Johns Hopkins University, on President Trump's executive order over the weekend intended to make it easier to research certain psychedelic drugs for treatment of trauma-induced PTSD. I guess by definition, post-traumatic stress disorder has to be trauma-induced, and addiction and some other things. And listeners, I wonder if anybody among you right now has any experience with this. Have you ever taken a psychedelic drug specifically for therapeutic purposes? Or maybe you're a therapist who, legally or not, has worked with patients using psychedelics. 212-433 WNYC. We have about 15 minutes for this segment because we did go long with Bridget, so this is going to be a little shorter than it might otherwise have been. And we do have to end at our end time for a few reasons, but we could get in a call or 2 or 3 for Dr. Barrett if anybody has direct experience with this or wants to ask him a question. 212-433 WNYC, 212-433 9692. You just talked about the cardiotoxicity of ibogaine. I see that there is, I'm just looking for the exact language, it's something to the effect that there's going to be human clinical trials for the first time pursuant to this executive order. It's going to pave the way for human clinical trials for the first time. I imagine that's something that you might do or might want to do at your center at Johns Hopkins. How do you do something like that with something like a psychedelic drug where you know you're treating trauma patients or people fighting addiction and you know there's a risk of deaths from heart implications?
Well, this is going to be a very tricky question to answer when people do go about applying for permission and approval to conduct these studies. One of the sources of the cardiotoxicity of ibogaine have to do with the feature of the chemical structure that, I'll be honest, is a little beyond me. I'm a cognitive neuroscientist, not a chemist, but there are aspects of the chemical structure of this compound that lead it to bind to certain receptors on the heart that cause arrhythmias and other things. And from what I understand, there are ways to try to approach this specific cardiotoxicity to either monitor and intervene if it becomes a problem, or even go as far as engineering the compound to engineer out that cardiotoxicity. But either way, that is going to have to be addressed within any clinical trials that occur with this compound.
Ben in Yorkville, you're on WNYC. Hi, Ben.
I'm very disappointed in this report because until there's a double-blind study, we have no idea if this really works. It's very much like they had staples in people's ears to cure addiction, or maybe prayer works. Who knows? I mean, believing that a drug really works because people report it. There's always reports on cancer drugs, all kinds of medical things that people say works tremendously and then we hear from it again. So encouraging people to take psychedelics as a cure for addiction is just bad. It's wrong and probably dangerous.
Thank you, Ben. But that's exactly what they're setting up here, is actual clinical trials to see what's really what, right?
Are you asking
Professor?
me? Yes.
Yes.
Sorry, I'm sorry. Yes, I want to amplify that caller's comments. None of the psychedelics that we're studying right now are approved as medicine, and so certainly they shouldn't be recommended for the treatment of substance use disorder, depression, trauma, or anything else yet. But yes, in fact, that's what is I think one of the things that the executive order has done right is to direct this further into the research pathway, and even then, for the clinical trials that are being conducted, they're being conducted in patients who are very carefully screened to make sure they're as appropriate as possible for the experimental intervention, and also participants are heavily prepared and monitored during drug effects, such that we can put as many kind of guardrails in place as possible to ensure patient safety. But I'm certainly not advocating right now that people go out and do this on their own, or that it can be or should be prescribed right now for these indications.
Yeah, in fact, Olga Kazan wrote in The Atlantic in 2024 that there's a problem, quote, problem for psychedelic research. Many of the studies underpinning these substances' healing powers are weak, marred by a true believer mentality among its researchers and an underreporting of adverse side effects, which threatens to undermine an otherwise bright frontier in mental health treatment, unquote. How do you, who runs the Center for Psychedelic and Consciousness Research, have to fight, if you think you do, what she called true believer mentality among its researchers?
I can't speak for all researchers in the field, but I can certainly speak for myself and my colleagues here at Hopkins that we take the responsibility of doing this research as objectively as possible incredibly seriously, and I think it's incredibly important to hold great equanimity, if you will, and objectivity when approaching this research. We do everything we can to inform potential study participants of the complete range, positive or negative, of outcomes that may occur after engaging with psychedelic studies. And truly, these compounds do not work for everyone, and they shouldn't be expected to. And on that note as well, people often lump psychedelics in with other substances that are misused and that cause intoxication. But I can tell you with certainty that some of the experiences that people encounter with these compounds, even in a very controlled setting such as ours, are incredibly difficult. Some of these are harrowing experiences, and some of the most challenging psychological experiences of a person's life. So, I think we have to be as careful as possible to not to follow the science and really follow the data. Mm-hmm. That being said, of the hundreds of study participants and patients that I've followed in clinical trials that I've been involved with over the past 13 years, we have seen some remarkable success stories. Some people that have suffered even a lifetime of illness, who after 1 or 2 doses of psilocybin have shown kind of remarkable recovery. And again, that's not to say that will happen for everyone, or that's even necessarily the modal response. And even the most effective therapies can have side effects. But I think that it is we owe it to the millions of Americans who are suffering from mental illness to try as hard as we can to conduct objective science so that we can explore all possible options.
Bill in Jersey City, you're on WNYC. Hi, Bill.
Hey, how you doing, Brian? Back in 1974, I was designed to build a house for a psychiatrist from the Menninger Clinic outside in Topeka, Kansas. And I'd had experience with mushrooms. Anyway, he said, I'm going to bring a bunch of patients out. And they had a pond there. And he brought about 7 or 8 patients of his along. We all dropped mushrooms. And it was just, I can't use the word, but it was crazy. It was like a scene out of One Flew Over the Cuckoo's Nest. Everybody was just running around like mad. I wouldn't think that it was a successful experiment.
Professor?
No, that does sound a bit uncontrolled and frankly a little scary if you ask me.
He's renowned. I won't give his name. He's dead now, but he was a renowned psychiatrist, and I was surprised it was 1974, a long time ago. So it was scary to say the least.
Well, a lot has changed. So go ahead, Simon.
No, you go ahead, Professor.
No, I was going to say a lot has changed since the 60s and 70s, and there are actually thousands of papers written on psychedelic drugs from clinic or laboratory perspectives in the 50s and 60s through the 70s, but the vast majority of those studies would not meet modern criteria for rigor or reproducibility. We don't see those as generating valid evidence that we can actually objectively assess today. But that's one of the reasons that we're going back and looking at some of these compounds, hopefully in as controlled of a way as possible, so that we can get a better idea of what the real values, what the possible risks and possible benefits are.
I know you got to go in 2 minutes. You're the director of the Center for Psychedelic and Consciousness Research at Johns Hopkins. So I just got to ask you a curious question. What does the consciousness part of the center's name refer to that's different from or a part of psychedelic research?
Mm-hmm. That's a great question, and at this point, it's a bit of an aspirational aspect of the title. People like to discuss and describe psychedelics as consciousness-altering compounds, and possibly even claiming that they expand consciousness, whatever that means. The word consciousness itself, we could spend an hour and a half just talking about what do we mean by that. But suffice it to say that I think that with our current scientific tools, we're really not completely prepared to dig into the question of what is consciousness scientifically, but that's a nod to the aspiration that maybe one day we will have those tools. And psychedelics represent such powerful modulators of consciousness. I think when people say that psychedelics affect consciousness, they mean that maybe they reveal some aspect of an individual's consciousness to themselves that they may not have seen before, but that doesn't mean we can study it. It's really just aspirational that one day we may be able to crack the code and better understand consciousness.
On President Trump's executive order over the weekend, making it easier to get FDA approval to study psychedelics as possible treatments for addiction and post-traumatic stress disorder. Frederick S. Barrett, Ph.D., Director of the Center for Psychedelic and Consciousness Research at Johns Hopkins University. Thank you so much for joining us.
Thank you so much, Brian.